by the actual wound itself. Now that the wound is cleaned, I can actually go ahead and collect a culture if I need to. To do that, you would take the culture at swab that is provided at the hospital, and you're just going to do kind of a rolling motion, one swipe down the wound, and send that off to lab. Now that I have the wound, the old dressing removed, the wound cleaned and measured and assessed, I am now going to clean my hands again, and I'm going to begin to assemble my sterile equipment. Notice I'm not reaching over the sterile supplies once they've been opened. I'm going to take my saline and I'm going to 4 to 6 inches above soak that with saline. I'm going to apply my sterile gloves. I ask this gentleman to hold very still for me. I'm going to use this surface for the gloves. Here to me. I can now wring out the excess saline from my packing gauze, and I'm going to fluff it up so that it's not too densely packed. Grab one of my sterile applicators. I'm just going to start with one corner of the dressing. The rest is going to be contained in my hand so that I do not contaminate it on the outer surfaces of the wound. I'm just going to start at one end and I'm going to begin packing. Very lightly, but making sure that I cover every surface of the wound. Once I have that done, I'm going to take my first layer of dry dressing and begin to cover the wound. I want to cover the least amount of healthy tissue possible so that I don't trap any moisture underneath there and cause the wound to expand or to create other wounds. I'm going to take my ABD dressing, which is a thick absorbent dressing that I'm going to put on the outermost layer. Once I have this done, I technically do not need to be sterile any longer. I'm going to use my tape and secure the edges. Using the least amount of tape possible on the healthy skin. Actually, let me backtrack for just 1 second. I'm going to use my skin prep, and I'm going to open that up, and I'm going to spread that out on the tissue that I'm going to actually put the tape adhesive on. Give that a second to dry. Once it's dry, I will then proceed to tape the dressing into place. Here I'm using a picture frame taping technique, so I'm covering and securing all 4 sides of the dressing. Once that's complete, I'm going to go ahead and take my pen, and I'm going to mark my initials, the date and the time of the dressing change. And I'm going to put that directly onto the wound, or not directly onto the dressing. I don't want to put it over top. The center, somewhere where it's visible. At this point, I would be wrapping up by collecting and discarding all of my equipment, getting the patient in a comfortable position, making sure they're not in any excess pain, and providing them with pain interventions if need be. I would lower the bed, raise the side rail, and wash my hands. Thank you. Wash my hands and leave the room to chart.